Hey there! If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation in Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
It has already been 15 years since the Zulig Family Foundation envisioned being a catalyst for better health outcomes for all Filipinos. And through the years, ZFF has forged partnerships to bring its health change model to far-flung and disadvantaged areas in need of leadership and governance interventions to address health system gaps. From focusing on maternal and child health while working with municipal and city leaders to collaborating with provincial leaders to ensure continuity of care, ZFF's programs on improving local health systems resulted in better managed pandemic response and faster advancements in universal health care maturity. ZFF's nutrition governance programs helped accelerate the decline in stunting prevalence rate when implemented in municipalities, cities, and provinces. ZFF's programs on adolescent sexual and reproductive health increased the uptake of contraceptives and reduced teenage pregnancies. With all that ZFF has achieved, it is but right that we celebrate 15 years of catalyzing improvements in health outcomes.
Happy 15th Anniversary Zulig Family Foundation!
Hey there! If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation in Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
It has already been 15 years since the Zulig Family Foundation envisioned being a catalyst for better health outcomes for all Filipinos. And through the years, ZFF has forged partnerships to bring its health change model to far-flung and disadvantaged areas in need of leadership and governance interventions to address health system gaps. From focusing on maternal and child health while working with municipal and city leaders to collaborating with provincial leaders to ensure continuity of care, ZFF's programs on improving local health systems resulted in better managed pandemic response and faster advancements in universal healthcare maturity. ZFF's nutrition governance programs helped accelerate the decline in stunting prevalence rate when implemented in municipalities, cities, and provinces. ZFF's programs on adolescent sexual and reproductive health increased the uptake of contraceptives and reduced teenage pregnancies. With all that ZFF has achieved, it is but right that we celebrate 15 years of catalyzing improvements in health outcomes.
Happy 15th Anniversary Zuling Family Foundation!
Hey there! If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation and Health Initiative, SIHI for short, pronounced as SIHI, which means upward, forward-looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
It has already been 15 years since the Zulig Family Foundation envisioned being a catalyst for better health outcomes for all Filipinos. And through the years, ZFF has forged partnerships to bring its health change model to far-flung and disadvantaged areas in need of leadership and governance interventions to address health system gaps. From focusing on maternal and child health while working with municipal and city leaders to collaborating with provincial leaders to ensure continuity of care, ZFF's programs on improving local health systems resulted in better managed pandemic response and faster advancements in universal healthcare maturity. ZFF's nutrition governance programs helped accelerate the decline in stunting prevalence rate when implemented in municipalities, cities, and provinces. ZFF's programs on adolescent sexual and reproductive health increased the uptake of contraceptives and reduced teenage pregnancies. With all that ZFF has achieved, it is but right that we celebrate 15 years of catalyzing improvements in health outcomes.
Happy 15th Anniversary Zuling Family Foundation!
Good morning, good afternoon, and good evening to everyone, depending on where you are in the world today. But mabuhay from the Philippines. Welcome to our SIHI Talks, and thank you very much for joining us. I am Hannah. I am the Hub Manager of the SIHI Philippines Hub, and I will be the moderator for this session. And this SIHI Talks is co-hosted by SIHI Philippines and one of our very close partners, the Zulig Family Foundation, or ZFF. And today we will explore the role of communities of practice in the implementation of our country's universal healthcare law. So to kick off this session, I'd like to call Dr. Meredith Labarda, who is the lead of SIHI Philippines and the SIHI Secretariat, for her opening remarks. Ma'am Meredith, you have the virtual floor.
Thank you, Hannah. And warm greetings from the SIHI, or Social Innovation in Health Initiative Global Network, and we are streaming live from the Philippines. So on behalf of the SIHI network that's composed of the different hubs from Asia, Africa, Latin America, and the Caribbean, and of course Sweden, our newest hub, together with our TDR colleagues and partners led by Dr. Beatriz Salpaap and Dr. Michael Mihot, I welcome you all to today's SIHI Talks with the theme Bayang Malusog. So it's a Filipino term meaning healthy communities exchange. And so that's a shortcut for BMEx. No? So that's the shortcut for Bayang Malusog exchange, fostering communities of practice to advance universal healthcare. And this SIHI Talks, as Hannah mentioned, is exciting because this is co-hosted by one of SIHI Philippines partners, the Zulig Family Foundation, that's led by their president, who is present in this Zoom platform now. That's President or Sir Austere Panadero. And today we would like to highlight Innovex. Again, that's a shortcut for Innovation Exchange, one of SIHI Philippines project in partnership with Zwilig Family Foundation. And this is supported by the Philippine Council for Health Research and Development, or PCHRD, as a platform for exchange in the Zwilig Family Foundation's communities of practice in partnership with SIHI Philippines. So we are excited for this exchange of ideas, of innovations, of anything that's brewing in terms of communities of practice. So we hope that everyone will listen in and be excited and learn and have a very productive and fruitful discussion and exchange of ideas today. So thank you very much and welcome to today's SIHI Talks. And back to you, Hannah.
Thank you very much, Ma'am Media, for that warm welcome and for encouraging us to be excited for this upcoming discussion. So now let us proceed to the main part of the session. And first, we will listen to a presentation about the Bayang Malusog, or again, Healthy Nation, and about its community of practice that is being spearheaded by ZFF. So for this, I'd like to call Dr. Catherine Chung, the Director for Local Health Systems at ZFF. Dr. Cathy, please go ahead.
Hello, everyone. Let me present the Zwilig Family Foundation's Bayang Malusog, or Healthy Nation Community of Practice, where we champion health together and accelerate universal health care in the Philippines. On February 20, 2019, the Philippines passed the Universal Healthcare Law to ensure equitable access to quality and affordable healthcare goods and services, while also protecting them against financial risk. It addresses the inequities the country's health system faces because of fragmented service delivery and an inefficient financing system. The aim is to gradually achieve universal health care by implementing a systemic approach and clearly defining the roles of various stakeholders, including Department of Health, PhilHealth, and Department of Interior and Local Government. This significant milestone aimed to help the DOH achieve its vision of having Filipinos among the healthiest people in Southeast Asia by 2040. The Zwilig Family Foundation is committed to helping the nation achieve and realize UHC. Its vision is to be a catalyst for improving health outcomes for all Filipinos, and its mission is to enable local health systems achieve these improvements through effective leadership and governance in partnership and cooperation with key stakeholders. The ZFF Bayang Malusog, or Healthy Nations Leadership Development Program, is one of the Foundation's programs. The program trains leaders from regions, provinces, and municipalities to expedite their UHC implementation and enhance their local health systems. The program achieves this by implementing key strategies such as leadership and technical training, providing coaching and technical assistance during the practicum period, monitoring and evaluating the outputs, and fostering a community of practice. These will contribute to the improvement of the following critical aspects of universal health care: responsive leadership and governance, integrated health financing mechanisms, functional health information systems, improve health service delivery, and an available, competent health workforce, and in the end, contribute to the heart of the program, which is a better health outcomes. We operate in 5 regions: the Ilocos region, the Cordillera Administrative Region, Cagayan Valley, Calabarzon, and Eastern Visayas, encompassing 23 provinces and 1 city. The program works in collaboration with the academic partners shown on the screen. Part of what we teach are academic partners and leaders in the Learning and Development Framework, which states 10% we train and learn in the classroom, 20% we learn from others, which is important in the community of practice that we are doing in the program, and 70% they apply and practice what they learn. The ZFF Local Health System #Bayang Malusog Community of Practice Framework states that the community of practice will facilitate the sharing of our partners' experiences in UHC and primary care implementation. According to the World Bank, 3 integral elements must be present in doing the COP. First, people, which is in this case our ZFF, our engaged leaders in the provinces, DOH, PhilHealth, experts, and our academic partners. Second, practice. Practice effective strategies and innovations on UHC and primary healthcare. And third, purpose. The purpose is to accelerate UHC and primary care implementation so that in the end, they will have a more people-centered intervention that will lead to better health outcomes. We will conduct the following activities, such as the sharing of knowledge, focusing on community-driven topics, documenting practices, and fostering learning through innovation. On the slide are the critical stakeholders who will be involved in the COP. And the knowledge flow will not only stop with the members of the COP, but it will also diffuse to other partner areas via training rollout and knowledge sharing events and in public fora and webinars. Here are the references of our COP shown in the slide. And thank you very much. Help us promote the SWILIG Family Foundation by encouraging other health leaders to follow its official website and other social media platforms by scanning the QR code shown on the screen. Thank you very much. Back to you, Doc Jana.
Wow, thank you so much, Doc Cathy, for that short but sweet presentation. Very concise, but it has all the elements to present to us, to provide us an overview of the UHC law, and to frame the COPs within the whole Bayang Malusog program and within also our desired outcomes for UHC. So let's continue this exciting discussion. So I would like now to call on the other esteemed panelists who will be joining Dr. Cathy with us today. So first, we're very pleased to have with us Dr. Mark Calban, who is the Provincial Health Officer of the Province of Apayao. Hello, Dr. Mark.
Hello, good day, everyone. I'm
day.
Dr. Mark Calban from Apayao, Philippines.
Thank you for joining us. Now I'd like to call on Sir J. Lawrence Janicio. He is a dedicated nurse within public health and is the UHC coordinator for the province of Aklan. Thank
Hello
you,
to
Sir
everyone.
J.
My name is J.
for
Lawrence
joining
Janicio.
us.
I am working at the provincial health office. Thank you.
Thank you, thank you. And finally, we are also delighted to have with us Dr. Catherine Joyce Deliosa Flores. She is the Division Chief of the Health Systems Development Division of the Bureau of Local Health Systems Development of our Philippine Department of Health. Thank you so much, Doc Cath, for joining us.
Thank you. Hello, everyone. Greetings from the Philippines. I'm Catherine Flores from the Department of Health. Thank you.
Thank you. And of course, Doc Cathy will also continue to join us in the panel. So may I request, there, please pin her also. Thank you very much. So again, we thank all of the panelists for joining us. And at this point, I would also like to invite our audience, all of the participants, to actively participate also in this discussion by posting your questions in the chat box. Or even if you are in the live stream in Facebook or YouTube, you may also post your questions there, and we have facilitators who will take note of your questions and bring it to us later. And we will do our best to manage the time to cover all of your questions. So let's just start. Let's start the ball rolling. So first, maybe just a deeper introduction of each of you. We're actually very excited and pleased to have you all with us because you are representing different levels of our health system. So can you please elaborate for us your specific roles and responsibilities in ensuring the successful implementation of our UHC law at the different levels? So I guess for this, I'd like to start with Doc Kat from the DOH.
So hello again, everyone. The Department of Health since 1991, when health services were devolved at the local government units, the role of the Department of Health has shifted from a direct provider to a technical assistance provider. So now, we develop policies and standards and also regulate public health facilities and provide capacity building services. And the management of the regional and specialty hospitals were retained at the Department of Health. For our bureau is named as Bureau of Local Health Systems Development. Our main role in the universal healthcare, we are the lead bureau in developing functional local health systems, in assisting the local government units, especially the marginalized and disadvantaged communities. So we work with key partners and stakeholders to create environments and opportunities in offering solutions to improve and strengthen local health systems policies and plans. So specifically in my division, our areas of expertise include local planning, financing, leadership and governance, local health systems integration, primary care policy framework, and some aspects of private sector engagement. Thank you.
Thank you, Doc Kat. And really, thank you very much for representing for us the Central Department of Health and its role in providing technical assistance to the local health systems. Let's move to our esteemed panelists from the provincial level. So I think I'll start with Dr. Mark Calvan. Can you tell us a little bit about your role as PHO, maybe also representing the other PHOs present with us today? And then later, Sir J-Lo.
So good day once again. The Provincial Health Office, specifically the Provincial Health Officer, actually has an essential role in the advancement of UHC implementation. And we have a role actually to strengthen leadership and governance within the local health system. So the governor and the PHO who is leading the charge towards universal health care in our province and all other provinces, and they actually act as drivers of the health system. They are also catalysts to spearhead the deliverables of UHC implementation, institutionalization, and sustainability of UHC key result areas. Secondly, we have a role to develop innovative and responsive approaches towards inclusive UHC implementation. So we have an integrated and institutionalized localized partnership programs. In our province, we have the Project Butsi, which brings actually integrated and partnership services to the grassroots or closer to the people or to the community, especially the GIDA. Integrated because we provide one-stop shop program for public health services like social behavior change communication, consultation, as well as referral to facilities. Partnership programs which has a role of the different levels of care in the province, the barangay for the dissemination through BHWs, RHU and PLGU hospitals, who takes the lead in the implementation, and PIDOHO and PHO for augmentation, such that in the end, the grassroots are not left behind through our ROSES strategy that is reaching out, serving every sitio. Next, a capacity building of staff necessary for leadership and management. So the provincial health team has been enrolled to leadership program such as the Provincial Leadership and Development Program, sponsored or co-sponsored by DOH, our partner from UP and Zwillig Family Foundation. And lastly, making the vision of UHC a tangible reality through partnership with NGOs and national line agencies, which will bring positive outcomes to the whole health system.
Thank you so much, Doc Mark, for outlining for us all of your responsibilities, really as the co-lead of the chief executive at that level in order to operationalize and even monitor all the key result areas for UHC. So Sir J-Lo, as the UHC coordinator naman po, can you share with us your role?
Yes, so again, my name is J. Lawrence Junicio. I am a public health nurse working at the Provincial Health Office in the province of Baclan. And currently, I'm the provincial focal person for universal healthcare. The province of Baclan is one of the integration sites for universal healthcare in the country. And since 2019, our province and together with our partners have working diligently in accomplishing several readiness measures, documents to make our province ready for universal healthcare. And with its universal healthcare, the province has a very massive role to fill for the universal healthcare. And we are glad to have our ever supportive provincial partners and even our regional partners and development partners like the Zwillig Family Foundation helping us in this journey. Thank you so much.
Thank you, Sir JLo, and really see how you have spearheaded, as a demo site. We feel the big responsibility for the selected provinces really to spearhead and show the preparedness and readiness for UHC implementation. So thank you very much, and thank you for sharing that. How about you, Doc Cathy? Maybe I know you presented earlier, but maybe speak again to the role, the very catalytic role of ZFF in all of this.
Hi, everyone. So as the director of the local health system portfolio or the unit in the Zwillig Family Foundation, I oversee various projects aimed at accelerating the implementation of UHC across our regions, provinces, and municipalities. My role involves ensuring that all communities receive the healthcare they need, working closely with local leaders and healthcare providers to create effective, sustainable solutions.
Thank you so much, Doc Cathy. And it's been, we saw in the video earlier, more than a decade already of ZFF championing and assisting the local governments to be able to improve their health systems. So thank you very much. So now let's move to sort of kumustahan, or how is it all going now? No? So can you tell us from your perspective, from the local or national level, how UHC implementation is going now? So can you tell us maybe the biggest milestones so far, but also the setbacks or the persistent challenges? So milestones and setbacks. Can we start with Sir JLo?
Yes. So again, as one of the sites for universal healthcare integration in the Philippines, our province of Aklan has considered this chance to be both a challenge and a privilege to be chosen as one. The main challenge is how to create local health innovations that will integrate our local health systems at the provincial level and somehow minimize different health inequities in our communities caused by the fragmentation in the delivery of health services. In my province, which is Aklan, we have been diligently working to integrate different levels of universal health care as outlined by the Department of Health. These levels include managerial level, the technical and financial integration levels. And since the passage of universal health care law in 2019, we have made significant progress in meeting the major requirements at the managerial and technical levels. However, there's still more work to be done, particularly in meeting the more complex requirements of financial integration. For the managerial and technical level of integration, the province of Aklan has made significant progress in integrating all our 17 local government units into a single province-wide health system through a memorandum of agreement signed by all our mayors in 2023. Additionally, an ordinance supporting the province-wide health system is in the final stages of review and approval by our provincial legislative branch. And in order to foster a more collaborative approach to implementing the province-wide health system, the province has established sub-provincial health systems, which we call them district health systems or DHS. This subsystem aims to facilitate a more effective and streamlined health service delivery. Under the provincial health system, 6 sub-provincial health systems have been established based on geographic locations rather than territorial boundaries to improve patients' access to healthcare. And each sub-provincial health system comprises several primary care facilities and a dedicated hospital. And the province is currently finalizing our financing contracts, policies, and guidelines to prepare for the arrival of special health funds as part of the financial integration. And as one of the 4 provinces in the Philippines, serving as a pilot site for the demonstration of the use of the special health funds, we believe that establishing the sub-provincial health system will help manage these funds efficiently. Although the task of being a demonstration site is challenging, we are confident that through collaboration and close coordination with our local government units, our local management committees, the Department of Health, and our development partners like the Zwilig Family Foundation, we can properly implement the system once it becomes operational. I can say for the setback or the persistent challenge on the universal healthcare, I am proud to say that leadership and governance are a less of a concern in our province. In fact, this is one of our strengths, I can say. This was made possible because of the help provided by our development partners, the ZFF, through their bridging leadership programs for governors and mayors. Our local leaders, especially our governor, Jose Enrique Miraflores, has made this vision of universal healthcare clear to every one of us. He became a goal-driven and hands-on leader. Our municipal mayors as well, on the other hand, have also understood this vision, and we can say that their health support has improved over time. So for the main challenge we are facing, I guess, is the creation of different policies and guidelines. Since we are a pilot site, we need to innovate and develop our own local policies and guidelines, such as those related to financing mechanisms for special health funds, taking into consideration the sub-provincial health system we established. And given the short timeline, the pressure to meet all documentary requirements is very high. But thank you to the support we received from everyone, especially to our governor, our provincial health officers, Dr. Leslie Ancidilli and Dr. Lea Ismael, and the technical assistance from the Zwilig Family Foundation and DOH, we're able to explore and exhaust all our possible solutions for Aklan. Though these collaborative efforts, we remain hopeful that the province of Aklan will be recognized by PhilHealth as a demonstration site for the healthcare provider network in the Philippines. Thank you.
Thank you very much, Sir Jalo, for outlining the status of Aklan, no, in the different areas of integration. You mentioned the managerial, technical, and financial, which are the different pillars of integration for UHC. And indeed, you speak to the importance of a visionary leadership, and also for the challenges that there's really opportunity to innovate, such as for the financial integration. So thank you very much for that. Dr. Mark, in Apayao, do you share the same milestones and challenges? And can you share more about your experience?
So in 2022, the province of Apayao became among the last universal healthcare integration site actually. So in the Cordillera Administrative Region. So nonetheless, the province swiftly completed all the preparatory requirements in the first quarter of the following year. And by the end of 2023, it had achieved 61.1% of organizational and 30% of functional level requirements. So from the 2 years that Apayao province had been integrated as a UHC IS site, we have been able to attain a 100% of RHUs that are DOH certified and PhilHealth accredited consulta providers. As well as in a short period of time, we have been able to create key positions at the Provincial Health Office, both at the Health Service Delivery Division and Health System Support Division. This is able to realize that our governor wants to educate and foster acceptance of medical services and health programs among the province population, which includes over 50% of indigenous peoples. So this aims actually to reduce unskilled home deliveries, the irregular checkup of patients, as well as other problems such as vaccine hesitancy. We have been able also to outsource funding for equipping and improvement of our provincially operated hospitals amounting to 60 million pesos deposited at the Special Health Fund. And with this, we will be able to realize that the health facility development plan for our hospitals will be attainable soon. We have also have a strengthened Apayao Central Pharmacy as the fulcrum of the supply chain system for the provincial local government unit operated hospitals, thereby reducing the out and overstocking of medical commodities. And currently, the consignment arrangement for drug supplies are also being explored. And we have also one practice in Apayao that was strengthened through the UHC is that we have the extension clinics. So these are the mini hospitals in the geographically isolated and disadvantaged areas. So there was a challenge actually to extend the 54 hard-to-reach villages. But the provincial government incentivized doctors and specialists to serve in extension clinics by offering a higher daily per dimes and free board and lodging to medical personnel. So although Apayo's doctor to population ratio currently stands at 1 is to 9,567, the contractual physicians stand to alleviate the health burden of the people in the province. So we have a governor, a seasoned politician, who successfully convened and actually persuaded all 7 municipal mayors. So those municipal mayors are actually 7 municipal mayors province-wide to actively participate in realizing UHC. So from that, he provided clear direction and ensured agreement among his provincial health team on their provincial respective deliverables. However, we have also different setback or persistent challenges. So in every system, there are challenges. In government, we have lengthy procurement system. That's why sometimes we have delayed implementation of our programs. Our referral system is still for institutionalization. So the proper navigation of patients to all levels of care, the two-way referral system also is still yet to be institutionalized. We have a lack of information system that is interoperable from primary to curative care. The geographical terrain of our province, we have unpassable roads due to landslides, which actually impedes the delivery of health services, as well as communication signals that is weak to none in some areas. So those are actually one of the setbacks or persistent challenges that we are experiencing in our province in the implementation of UHC.
Thank you so much for sharing all of those, Doc Mark. And I would like to congratulate you and also Sir Jelo. So both the provinces of Apayao and Aklan have really achieved a lot already in the past few years for your readiness to implement UHC. And even now, and this is the point of the platform, I guess, you are already sharing your best practices, both from Apayao and Aklan, and possible innovations that other provinces can actually learn from. So we are excited for the continuation of this discussion. But now I'd like to go to Dr. Flores, Dr. Kat Flores. At the national level now, how is the view? How is the perspective? Where are we in the UHC law implementation?
Thank you, Jana. So I have meaning to talk more about the other accomplishments of the UHC, but since my co-panelists here have mentioned the local health systems integration, I want also to emphasize that. And also, for the sake of our listeners coming from abroad, I want to explain how the UHC or local health systems integration take into place. So, in order to mitigate the effects of devolution in 1991, one of the strategies espoused in the Universal Healthcare Act, which was passed in our country last 2019, is the integration of local health systems into province-wide or city-wide health systems. So local government units which have committed to integrate into province-wide or city-wide health system shall exhibit managerial, technical, and financial integration for the first 6 years upon the issuance of the Act. So when we say managerial integration, it is the consolidation of resources over different resources within the province or citywide, such as health human resources, health management, operations, etc. When we say technical integration, there shall be efficient linking of service delivery from primary care, secondary, tertiary, basically at all levels of care, and that the province-wide and city-wide health system shall be linked to an apex hospital so that the service delivery is complete. Lastly, the financial integration is the creation of a pooled fund managed by the provincial or city health board within the province-wide or city-wide health system. So this pooled fund or special health fund should be used exclusively for health projects, programs, and activities. So that's for managerial, financial, and technical integration. So we have the DIL, the Department of the Interior and Local Government, the DOH, shall endeavor the local government units to integrate so that there will be a seamless and coordinated referral system for the clients from the primary to tertiary and to specialty hospital. So currently, there are, as of today, there are 91 local government units which have volunteered to be UHC integration sites, and that include province of Apayao and province of Aklan, which are our co-panelists for today. So in terms of accomplishment, there have been various of levels or levels of maturity of the 91 pilot areas. We have set a monitoring tool consists of input and process indicators wherein we can actually tell whether the local government unit is in the preparatory stage or in the organizational stage or in the functional stage. So technically, majority of the UHC integration sites are in the organizational stages and are nearing towards the functional stage. So there are various indicators, but just I can say is that majority of the sites have already created their primary care networks, have already expanded their provincial and city health boards to include other representatives like private sector, indigenous people representative from the component municipalities or cities if it's a province, and representatives from the hospitals. Also, out of the 91 UHC integration sites, there are almost 60 which have created their special health fund depository bank accounts, but only 20 have operational special health fund. So that's just a snippet of the accomplishment in terms of local health systems integration. I would like also to include other accomplishments when it comes to universal healthcare. In terms of population coverage, we now have 100% coverage. All Filipinos are automatically covered by the National Health Insurance Program. In terms of service coverage, the country has started licensing primary care facilities and certifying primary care workers, or increasing the competencies of our primary care providers, including the public health doctors, rural health physicians, public health nurses, and the rural health midwives. The PhilHealth has implemented the Consulta benefit package or the primary care benefit package and is continuously expanding services and coverage for this. Further, outpatient drug benefit package is for pilot testing. So we all know that the major source of out-of-pocket spending in the Philippines is the major source of spending rather in the Philippines is still out of pocket. There is also a move to integrate standards of care per life stage approach. And the DOH also is currently partnering with the different agencies to create standards on healthy settings such as healthy communities, healthy schools, healthy workplaces, and healthy hospitals. In terms of financial coverage, two of the major strategies in our UHC are the following. First, the shift from a facility-based contracting of PhilHealth to network-based contracting, meaning they will not be contracting individual facilities, but rather they will be contracting healthcare provider networks. So whether it be a public-led healthcare provider network, mixed healthcare provider network, or private healthcare provider network. However, we have no model yet for the private healthcare provider network. And currently, there are 8 local government units which will be piloting or which are piloting and which will be piloting this network contracting from the PhilHealth. And also additional major accomplishment espoused in the UHC is the shift from reimbursement payments of the National Health Insurance Program to prospective payments, meaning there will be advance payments on the services so that the local government units could actually fund the missing inputs, like if they have shortages in HR, shortages in EMR commodities, they have the necessary funds to implement or to provide services to their constituents. So that's two of the major accomplishments in terms of financing. But as I have stated, it is still on pilot. So what have been the persistent challenges? I agree with Sir J. that one of the difficulties when it comes to integration is the financial integration, because we're trying to integrate the local health systems into province-wide and city-wide health systems. But technically, by virtue of the local government code, within the province-wide health system, they are still independent local government units with independent local chief executives. And it is also very hard in terms of financial integration because they're creating a pooled fund at the level of the province, and all of the different component local government units within the province have to agree and have to have a representative within the health board, have to agree on how they would manage the fund, because all the funds will be accruing to the special health fund. And then how would they allocate resources to the different component LGUs. So whether is the priority the facility or the health human resource, etc. So that would that would be the discretion of the health board, provincial health board, or the city health board led by the governor or the city mayor. So for now, we have only 20 operational special health fund, integration sites with special health fund. And we're still reviewing the policy on how we can enhance more in terms of financial integration. And of course, the additional problems would be the shortages in human resources for health, procurement, and supply chain management, and underdeveloped primary care facilities. And yeah, that's all. Thank you.
Yeah, thank you very much, Doc Kat. And really, it's still reflected in the local governments, and really still seen, of course, at the central level, all of these challenges in the different areas of the integration, but particularly in the financial integration. And that is where really the COPs hope to contribute also. So I'll shift a bit the discussion to that now, to zeroing in to the COPs and its role in advancing UHC. For this, I'd like to start with Doc Cathy. So specifically the Bayang Malusog exchange, or of course, as Doc Meredith mentioned, we will call it BMEx. And I know you will have a BMEx Thursdays starting from now. How do you see it specifically contributing? What will be the main activities, and what are the supports needed for this?
Yes, thank you, Doc Jana. So we envision this platform as a collaborative space where local leaders can effectively implement UHC through innovative and sustainable strategies. Working together allows us to co-create solutions that meet the unique needs of our communities. Key activities will include face-to-face community of practice learning exchanges and regular BMEx sessions through the Innovex. So that's every Thursday. And this initiative is part of the BMEx Bayang Malusog program, or Healthy Nation program, developed in partnership with DOH, Centers for Health Development, and the academic partners. So to succeed, we require comprehensive support, including technical assistance, coaching, and mentoring from our DOH regional offices, And additional funding for the innovative strategies developed through the COP will also be crucial in driving our efforts forward.
Thank you, Doc Cathy, for outlining the different possible roles for the different stakeholders for this to be successful, and of course facilitating this platform, hopefully to harvest innovations in aid of UHC implementation. How about for Dr. Mark and for Sir J-Lo, what specific areas of expertise or knowledge do you hope this Bayang Malusog exchange will really contribute? Or do you have specific topics in mind that will really help you in your work that we could discuss in the BMEx group? Dr. Mark, let's start with you and then Sir J-Lo.
For me, at the provincial level, ang pinaghuhugotan namin, so are still our challenges in the
Right.
towards UHC implementation. And first is actually the referral system. So referral system, because we have a challenge actually in the proper navigation of patients. So most patients right now in the province bypass some level care facilities such as the barangay health stations, thereby causing congestion to some hospitals. So actually, the two-way referral system also has not yet been established, as well as a good telemedicine platform to be used, especially among the geographically isolated and disadvantaged areas, since our province is also has different geographical terrain. Secondly, aside from the referral system, we want also to know more through the community of practice, health financing mechanisms, so as well through an institutionalized system of health spending from the special health fund has not yet been established as of this point. So yun po yung those are actually the priority expertise or knowledge that we want or hope to improve with through the Bayang Malusog exchange or the community of practice.
Thank you, Doc Mark. So really the referral system, financing still the big challenge, and supply chain management. So Sir J-Lo, do you share those thoughts also? And could you add any other topics that you want to be discussed?
Yes. For me, the community of practice will be highly beneficial for everyone. As one of the pilot sites for universal healthcare in the country, we can learn from the experiences of other provinces or other pilot sites, which may also apply to us. And since the province of Aklan's concept of the sub-provincial health system in the management of special health fund is seen as a model or a proof of concept in this community of practice, we are also eager to learn more about how other pilot areas or provinces are able to manage and utilize their funds from the provincial level down to the local government units, and possibly explore other potentials of involving other stakeholders like the private sectors to enhance our sub-provincial health system. Since our province is currently primarily utilizing public or government health facilities, initially involving them, but involving private facilities may also enhance our current province-wide health care system. So involving private sectors, we are also hoping to hear more of that from other provinces.
Thank you, Sir J-Lo. Indeed, no, hopefully the platform will help us harvest these innovations and models, no, for those specifically also that partnerships with different stakeholders, particularly the private sector. In the interest of time, I'm looking at the time. That discussion has been very exciting, and so we took a long time. So I think we have time for just one question. I'm checking the questions in the chat. I'll focus on just one, and I guess this will be for Dr. Kath. Do you think the COPs in general will remain a mainstay strategy in advancing UHC? And do you already have examples of successful COPs or at least knowledge exchange in advancing UHC?
Thank
Yeah,
you, Jan.
sorry, Doc Kat?
Sorry, you're both Kat. But maybe Doc Kat Flores first, and then Doc Kat, you can add a little bit. Thank you.
So thank you, Jana, for the question. Actually, I think that the community of practice will remain as one of the cornerstone in expediting the UHC implementation. Why? We have 91 models, 91 UHC integration sites, and it is very critical to document the innovations and or good practices that these sites have been experiencing towards their journey on UHC, so that we can learn whenever we will be replicating this local health systems integration nationwide upon the assessment of an independent study. Then we know what areas could we actually replicate based on the documented knowledge products that we can have. And also, COP, the community of practice, helps create an environment wherein there's a collaborative learning among different practitioners from national, local, from government to private. So actually, we're embodying what was espoused in the UHC, because we can achieve UHC in a whole of society approach, whole of government, and whole of system approach. So I think COP would be very beneficial, not just in UHC, but also for us practitioners, professionals, because we can help everyone in troubleshooting, especially not just the policy issues, but also the operational issues. And lastly, translate these experiences into useful knowledge products. Thank you.
Right. Thank you, Doc Kat. Indeed, and we hope that this will facilitate true multi-sectoral approach for UHC, and we will do our best. Even SIHI, that is one of our goals, to be able to contribute by documenting these innovations. In Doc Kathy, would you like to add anything to that to wrap up this discussion?
Yeah, COP is essential in the diffusion of learnings to create models in the integration of UHC. And it will be a platform of exchange where everyone can learn and innovate. And through this, we can create proof of concepts that UHC worked in the Philippines. And on the second question, what is the critical ingredient in initiating the community of practice? I think one of the important ingredient is the commitment of our leaders to learn, continuously learn and innovate in terms of UHC implementation, and also working with other provinces and other leaders so that they can adopt some good practices where they can integrate into their strategies for effective implementation for UHC.
Thank you so much, Doc Kathy. And I think we could end on that note, and let's all please give a virtual round of applause to our panelists. Thank you very much for all of your inputs, and of course, more than that, your dedicated service to make UHC a reality. So indeed, no, as we say in the Philippines, malayo pa, pero malayo na, meaning we have still a long way to go, but we've already also gone a long way. Thank you again to our panelists. And at this point, we will now formally launch the Bayang Malusog Exchange Group on the Health Innovex platform. My colleague, Joreb, will now show us the group in the platform, and we will have a ceremonial first forum question that will hopefully trigger the discussions here. So you will see in the healthinnovex.org, in the community, you have groups. And the first question will be, how is the implementation of UHC in your province so far? And what is the most challenging area of integration for UHC? We're now adding the post. And again, you would like to remind the Bayang Malusog, the BMEx, and the Bayang Malusog provinces and members of the COP that this forums will happen every Thursday. So we'll be using hashtag BMEx Thursdays for this. And hopefully you can all join in the discussions in this platform. So I apologize that because we are already at the last 4-minute mark. I think we will extend by 2 to 5 minutes. But Gloria, it's okay. We will continue the forum discussions in the platform later. But at this point, we'll also invite everyone to please join Health Innovex. Let us show the video introducing that platform.
Are you an innovator who has bright ideas to improve healthcare in the Philippines? Or are you someone who supports and funds innovators to bring their ideas to life? Are you a researcher seeking to do meaningful work in improving innovations and measuring their impact? Or are you an organization looking for innovations to adopt, integrate, or scale? Do you value collaboration and partnerships in creating and developing innovations to improve the health of Filipinos? Then join this growing network of like-minded individuals and groups in an exchange platform for social innovations in health. Introducing Innovex, the social innovation in health exchange platform. 3 core pillars define our platform: ideate and innovate, engage and exchange, study and learn. Ideate and innovate is where ideas take flight. Whether you're an innovator, researcher, or healthcare worker, this is the space to ignite creativity, share insights, and collaborate on groundbreaking health innovations. Engage and exchange is your virtual amphitheater for knowledge exchange. Connect with a diverse network of innovators, thought leaders, and pioneers who share your passion for social innovation. Study and learn is your gateway to continual growth. Dive into an extensive collection of resources and expand your perspectives. Immerse and learn all about the healthcare innovation landscape. Innovex isn't just a platform, it's a movement toward a future where collaboration sparks innovation, where healthcare is not just accessible, but truly transformative. Visit Innovex and join us today.
Thank you very much. And again, we invite everyone to please join the Health Innovex platform, join the discussions, ideate and innovate with other stakeholders and health system actors. At this point, we'll hear short responses from our colleagues from TDR. First, I'd like to call Dr. Michael Mihut, who is the head of the innovation unit in TDR.
Thank you very much. And just a brief note to say congratulations for this achievement. At TDR, as co-founders of SIHI, Social Innovation in Health Initiative, we are committed to working to support research to improve access to healthcare. And in this direction, we are happy to see that these efforts that the Philippines hub of SIHI have done in collaboration with their partners are leading towards mainstreaming social innovation, institutionalizing and making it official, and creating this framework where innovations are fostered. So thank you very much again. Great presentations, by the way. Thank you.
Yeah, we appreciate really the support of TDR. I'd like now to call Dr. Beatrice Halpap, who is the SIHI co-founder and lead also at TDR.
Thank you, Yana, and thank you, everyone. First, congratulations to put this together. Congratulations for this event, and thank you so much to share. Congratulations for the great partnership that you're showcasing here. Is the ideal partnership where you have all types of players coming together. And finally, congratulations for launching such an innovation on its own. So I think it's really coming at the right time. We've been, this week is the World Health Assembly, and aside in Geneva, there are many side meetings, and some of them are from, organizations supporting innovators like Grand Challenge Canada, Grand Challenge Africa, and there's also the Health Innovation Exchange that you will recall. And what was very nice this year is to see that actually the whole world seems to realize much more today than any time before that technologies are just technologies, but the social aspect to come and put these technologies to the people who need them or to do has been really missing and is so critical. So there is a lot of appetite, I think, to see how people can come together, multi-sectoral, multidisciplinary. All this was very much highlighted as a need. But how do you do this? It's not that often and that obvious. So with, of course, all the hubs, and the SIHI has been pioneering in bringing such a platform of face-to-face in the meetings to discuss. But this Innovex is an opportunity to really scale this up in a way, virtual way, where going beyond what has gone so far and actually co-developing and sharing and learning. So I think it's very exciting. It has a great potential to go very far, and definitely we need to record and follow really all the impact, all the results, so that we can showcase that and possibly be able to scale it up. So congratulations to all. That was a really nice event. Thank you. Over to you,
Thank
Yana.
you. Thank you so much, Beatrice. And really, this gives us much cause for excitement and hope. And so to close this very fruitful session, I would like to call Mr. Austere Panadero, the president of the Zuilek Family Foundation. Sir Austere?
Yeah, thank you, Doc Jana, and let me congratulate and thank our resource persons, Doc Mark, J-Lo, Doc Catherine of the UH, and Doc Cathy, for very effectively conveying what the value of a COP process is in our address the issues of the UHC implementation in the country. So indeed, this is really a challenging time for the Philippines in terms of retooling our local health systems from more than 3 decades of very devolved and fragmented delivery. But we are excited hearing from our resource persons of the initial gains, as well as the that they have achieved, as well as the challenges or the persistent challenges, as was referred to, confronting in this very complex change process. But I think we'd like to thank SIHI for introducing this platform, or a movement that really the cornerstone of which is the belief that we need to really move a bit faster, and this process in fact allows the problem solving in a much faster way as we exchange information and as we exchange data. But the cornerstone, I think, is the principle that we all believe in, that we just have to find better ways of doing things moving forward, continuous improvement. And I think this Innovex platform is going to be one of the principal tools. So I think, again, thank you very much to the resource person, DOH, SIHI, and ZFF on our end. We are fully committed to support our LGUs, and in terms of rolling out UHC and achieve progressive realization of the goals of the UHC. So thank you again, and we look forward to a very productive use of our platform and a success to the BMEx. Thank you very much.
Thank you very much, Sir Austere. And at this point, we would like to invite everyone who is able to turn on their cameras for a quick photo op. Is it Jean who will give us the instructions for the photo? Or someone from ZFF? Hi, Doc Kat. Nice to see you. Doc Kat, live from Leyte, Samar. Is it Julia or Jean who will take
Yes.
the screenshots?
Okay.
Okay, it's Julia. Please go ahead.
Last call for cameras before I take the screenshot. Okay. And 1, 2, 3, smile. Okay.
Thank you again to everyone. Thank you to our panelists. Thank you, ZFF, and for all who participated. Please join us again in the next SIHI Talks and the next SIHI events. Also follow ZFF in their social media platforms to be updated about their amazing work. So good day to everyone. And again, mabuhay from the Philippines.
Thank you.
Thank you. Thank you so much, Michael. Thank you, Beatrice.
Bye.
Thank you.
Thank you.